If you are new to my channel and want to educate yourself more about herpes viruses, please like my videos and subscribe to my channel. Make sure to ring on the notification bell so that you'll be the first to watch my uploaded videos every day. Let's put an end to the herpes virus.
Shingles treatment: valacyclovir. What is valacyclovir? Valacyclovir, Valtrex, is actually an antiviral drug that works against herpes virus like genital herpes, cold sores, herpes simplex virus 1, chickenpox, as well as shingles. Antivirals function through creating it more difficult for virus to duplicate themselves as well as spread out coming from cell to cell. Valacyclovir is actually a prescribed drug that you get through mouth immediately after developing the virus. It is actually essential to understand that valacyclovir doesn't cure the virus forever, it just treats the existing episode, making it much less painful as well as settle a lot faster compared to it without medicine. Likewise, valacyclovir could be utilized long-term, suppressive treatment, to avoid or even reduce outbreaks. Can valacyclovir treat shingles? Records reveals that even when valacyclovir is started more than 72 hours after a rash's appearance, there can easily still be some benefit. In some cases, depending upon your discomfort level, your healthcare provider might suggest pain medicine or even over-the-counter treatments, calamine cream, oatmeal baths, and so on, together with valacyclovir. Just like other herpes infections, valacyclovir doesn't cure shingles. It can easily make your existing episode much less uncomfortable as well as settle a lot faster if started immediately. Indeed, valacyclovir is actually an FDA-approved treatment for herpes zoster, in addition to genital herpes as well as cold sores. It reduces the duration as well as severity of symptoms. It must be started immediately after the outbreak begins. You will certainly obtain the very best response if you get the medicine within 72 hours of the rash showing up. Is valacyclovir risk-free? Valacyclovir is normally properly tolerated. Nevertheless, like all of medicines, valacyclovir does have actually adverse effects. One of the absolute most common adverse effects of valacyclovir consist of migraine, nausea, stomach discomfort, fatigue, anxiety, as well as skin rash. Let your healthcare provider know if you experience any one of these symptoms, particularly if they are actually extreme or even don't improve. Major adverse effects can easily occur, particularly in the elderly people along with kidney issues, or even those along with compromised body immune systems. Elderly individuals that utilize this medicine go to a greater risk of central nerve system side effects like anxiety, hallucinations, confusion, and so on. Likewise, individuals with kidney issues, renal illness, are actually most likely to have adverse effects from taking valacyclovir, as well as some might also experience renal failure. Immunocompromised individuals, like those along with HIV, AIDS, might establish a blood disorder referred to as thrombotic microangiopathy that impacts their red blood cells as well as platelets. Valacyclovir is actually categorized as pregnancy category B by the FDA. This implies that there are actually no sufficient as well as well-controlled studies of valacyclovir utilized in pregnant women. For that reason, valacyclovir ought to be actually utilized in pregnancy just if the potential benefit justifies the potential risk to the fetus. Nursing ladies ought to likewise be careful when taking valacyclovir, as well as should look for medical advice prior to starting this drug. Valacyclovir can easily interact along with various other medicines that you might be actually taking, like cladribine or even foscarnet. You should prevent taking valacyclovir if you are actually currently on those medications. Talk with your healthcare provider about every other potential drug interaction prior to beginning valacyclovir. Valacyclovir might likewise disrupt the efficiency of the varicella or even zoster virus vaccine. You should prevent taking valacyclovir 24 hours prior as well as 2 weeks after obtaining the vaccines. Make sure to inform your healthcare provider about any other medical concerns you might have actually, or even medicines that you are taking before beginning valacyclovir.
Thank you for watching. And please subscribe to my channel for my upcoming herpes treatment videos.